Go.
Hi, how are you guys? So for today's video, I just wanted to show you very quickly how to go ahead and do a subcutaneous injection. So for those of you that are not familiar with a subcutaneous injection, there are different types of injections that you can do in a patient. You can do an IM injection, which is in the muscles, like those flu shots are an example of IM injections. And you can also do what is called intradermal exams as well, like your regular PPDs. But today I'm going to show you guys how to do a subcutaneous injection, which is going to be more like your Lovenox. Also, insulin tends to be a subcutaneous injection as well. So what are the different sites for your subcutaneous injection? Usually the good spots are like towards the back of the arm, anywhere there's like a fatty area, or you can use the abdomen as well. So those some of the sites that you're able to use. You always want to avoid any site that has a lot of bruising or any site that has like a lot of trauma in it. So you just have to look at the patient just to make sure that you're using a good site for them as well. Okay, so what are some of the things that you're going to need? So I'm going to go ahead and show you guys how to do a subcutaneous injection. For example, let's just say Lovenox. Lovenox is a subcutaneous injection. And we also have heparin is also a subcutaneous injection as well. Okay, so some of the things that we do need is I'm going to get my needle. Usually you want to try to use a 25 gauge needle, like about 5 to 8 inch of a needle as well. So I'm going to take this out of my hands. And I try to use the smallest syringe possible. Like this one is just a 3 cc syringe. So you want to use the smallest one because if you use, for example, like a 10 cc syringe, it's a lot too much pressure when you are trying to give the injection. So you want to use a smaller syringe and make sure that you have the right size needle for your subcutaneous injection. Okay, just like with any procedure, I already told my patient what I'm going to be doing. I'm going to go ahead and do some hand hygiene, right? Perfect. So I'm going to go ahead and just apply my gloves. All right. So I have, this is my patient. I just said that this is. So what I'm going to go ahead and do is we're just going to go ahead and clean the site. I already have the site that I want to use. Like I said, you can use the back of the arm or you can use a fatty area in the abdomen. So you're going to go ahead and clean. Always want to clean a patient for at least a good 30 seconds. Okay, so I clean my patient. So while this gel dry, you never want to give an injection or IVs or lab draws or anything like that on a wet surface. I'm going to go ahead and let that dry out. So let's just say that I already have my medication on here. Okay, so just pretend that I do have my medications here. So as you can see, this is a much smaller needle, so it's always going to be bevel up anytime that you do any types of injection. And for subcutaneous, you're always going to go between a good 45 degrees. So it does just say the patient is a lot bigger of a patient, they have a lot of fat, then it's okay just to go ahead and do like a 90 degrees. But for the most part, for subcutaneous injection, it's going to be like around 45 degrees. Okay, all right, so my site's already clean. I already have my medication in there, just like I mentioned. So 45 degrees gonna look more like this angle. So 90 degrees gonna be straight down, but 45 degrees is more towards this angle. So I'm just gonna go ahead and inject my patient, give my medication, and then go ahead and take it off. You never want to recap needles or anything like that. Just close it up and throw it away in your sharps container. Okay, just gonna go ahead and grab a new alcohol wipe, clean the site, and then you'll be all set. But don't forget, when you are doing subcutaneous injection, you're giving medications such as heparin or anything like that. You do want to make sure that you're looking at your labs for these patients as well, just to make sure like your platelets is okay and there's no contraindication for giving those type of injection. All right, I love you guys. Take care. Don't forget, the world needs exactly what you have.